And what I want to actually focus on in my 4.5 minutes now is social amnesia. I have been reflecting on, since I engage in HIV research for the last 15 years, I seldom have met a critical historian who's part of our research, and I think that it's time for us to think about it. And as I was trying to think about how do I connect the presentation by Janet as well as the presentation by David, and as Janet had pointed out, colonialism and racism is actually, they are the driving force behind the syndemics to a large extent, and in some way, very often in Canada, especially now that Trump is making Americans look so bad, we deny that we actually had racism or colonialism or that type of historical legacy. And I just want to give an example how colonialism and racism still impact on LGBTQ communities at this point. So in 1533, Henry VIII established the first legislation against homosexuals in England. And it's an act that criminalized people, but at the time it was done because they wanted to persecute the nuns and monks. I'm not a historian, I won't pretend to be. But what the impact is not only negative impact in England, but that as the British went and colonized around the world, it actually had a lot of impacts because those laws become the laws in those lands. In the 1920s, England had actually colonized 1/4 of the entire globe. So you just think about places, all these laws are in there. So in 1967, the law in England and Wales was amended. So homosexuality was decriminalized, but this type of removal of unjust laws and persecution was not removed from the countries that were colonized. And in that way, nowadays in Asia, many countries, in 2016, 72 countries around the world still criminalize LGBTQ people, and it's mostly in Asia and Africa. And I have heard and seen on the internet amongst colleagues the kind of comments that came out to say that how uncivilized those countries are. We need to put in human rights and eliminate that. But little do we think about that before colonization, sexuality was actually very fluid. In many of these countries, homosexuality did not exist because people were welcome to express their sexuality and intimacy in whatever way they want and their desires, as long as it's actually not harming anybody in the community. So that is just one way to kind of think about that. And when I look at coming back to nowadays, I do work with the African, Caribbean, Black communities, the Latino communities, immigrants and refugees, and non-citizen people in the Greater Toronto area. And racism continues to affect people. Homophobia continues to affect that. And this is why stigma become an issue. Another thing that we also need to think about is in recent years, we talk about trauma. I don't know how many minutes I still have. I talk fast. But trauma need to be looked at as multi-generational. So look at what happened to African, Caribbean, Black people. We cannot just say that slavery did not affect Canada. We cannot say that right now our system had kind of become equitable because we had human rights. When I go and talk to young people, those who are living in the low-income marginalized community, majority of them are from the Black communities or they're from the indigenous community, racialized communities. When I went in March to talk to a group of young people and I want to ask them, how do they define masculinity? How do they see they themselves as young Black men being vulnerable? They don't want to talk to me about that. For 30 minutes, they were questioning me. Suddenly it turns, the focus on me, and I welcome that because it was a humbling experience and it made me reflect on my privilege. And they want to say, Josephine, how come you wouldn't come into my neighborhood in the evening? And they talk about the issue that they're concerned about is why is it that they cannot go home feeling safe? That any time on the way from school that we take for granted, that our children take for granted, they are actually stopped by the police because they are doing a neighborhood investigation? Why is it that every time when young people say that, stay low, they automatically lie down on the floor? Because they know that there could be violence that is happening, either within the community or actually being imposed by the police. Why is it that the young man that I used to do research with, Desmond Cole, when I read his article, and we actually went and did research way back in 2007. He was a university graduate then. A young person being stopped by police over 300 times is unacceptable. So those are the type of things that we need to think about. If we are really going to stop about syndemics, we need to address not only HIV stigma, but what about sexual stigma? What about stigma that is tied to addiction? What about stigma that is tied to mental health? Are we doing intervention that is addressing that? So tied to the resilience, why are you not waving at me yet? I only 5 minutes. So the one thing that I feel very proud of and very grateful to my team is the work by the Committee for Accessible AIDS Treatment. We did an intervention to address HIV stigma, but the outcome is actually we have proven that we're able to address stigma that's tied to racism, tied to sexuality, ties to mental health and addiction. And I was challenged one time by my colleague and say, who are you guys to go and intervene people's behavior? And so I want to make it clear to all of you, when we do intervention, we're not intervening individual behaviors. We are intervening the unjust and unfair and discriminating systems. That's what we are intervening. So at the end, we are actually promoting collective empowerment.